Eczema, also known as atopic dermatitis, is a chronic inflammatory skin condition that causes the skin to become red, itchy, dry, and cracked. It is a common skin disorder that affects millions of people worldwide, from infants to the elderly. Although not contagious, eczema can significantly impact a person's quality of life due to its persistent symptoms and the emotional toll it can take. Causes and risk factors. The exact cause of eczema is not fully understood, but it is believed to result from a combination of genetic and environmental factors. People with eczema often have a gene mutation that affects the skin's ability to retain moisture and protect against irritants, allergens, and microbes. This defective skin barrier allows moisture to escape and irritants to enter, triggering inflammation. Eczema often runs in families and is associated with other atopic conditions such as asthma and hay fever, suggesting a genetic predisposition. Environmental triggers such as allergens, like pollen, dust mites, and pet dander, irritants, such as soaps, detergents, and chemicals, temperature extremes, and stress can exacerbate the condition. Symptoms of eczema. Eczema symptoms can vary from person to person, and even from one episode to another. Common symptoms include dry, sensitive skin, red or brownish-gray patches, intense itching, especially at night, thickened, scaly, or leathery skin, from chronic scratching, crusting or oozing in severe cases, swelling or inflammation. The affected areas often include the face, neck, hands, wrists, ankles, and the creases of elbows and knees. In infants, eczema often appears on the cheeks and scalp. Types of eczema. There are several types of eczema, including atopic dermatitis, the most common form, often associated with other allergic conditions. Contact dermatitis, caused by skin contact with an allergen or irritant. Dyshydrotic eczema, involves small, itchy blisters on the hands and feet. Nummular eczema, characterized by coin-shaped spots on the skin. Seborrheic dermatitis, affects oily areas of the body like the scalp and face. Stasis dermatitis, occurs when there is poor circulation, usually in the lower legs. Diagnosis. Eczema is usually diagnosed based on the appearance of the skin and the patient's medical history. A doctor may inquire about symptoms, family history of eczema or allergies, and possible triggers. In some cases, patch testing may be done to identify specific allergens causing contact dermatitis. Treatment and management. While there is no permanent cure for eczema, it can be effectively managed with a combination of treatments and lifestyle adjustments. Moisturizers, emollients. Keeping the skin well hydrated is crucial. Emollients form a protective layer on the skin, reducing dryness and protecting against irritants. Topical corticosteroids. These are used to reduce inflammation and itching during flare UPS. However, long-term use should be avoided due to potential side effects like skin thinning. Antihistamines. Oral antihistamines can help control itching, especially at night. Immunomodulators. Topical medications like tacrolimus or pimecrolimus may be prescribed for sensitive areas or long-term control. Antibiotics. If the eczema becomes infected, antibiotics may be necessary to clear the infection. Phototherapy. Ultraviolet, UV, light therapy can help severe cases that don't respond to topical treatments. Biologic drugs. Newer treatments like dupilumab, a monoclonal antibody, target specific immune pathways involved in eczema and are effective for moderate to severe cases. Lifestyle and home remedies. Avoid known triggers such as harsh soaps, fragrances, and allergens. Use gentle, fragrance-free skincare products. Take short, lukewarm baths and moisturize immediately afterward. Wear soft, breathable clothing, preferably cotton, to reduce irritation. Manage stress, which can trigger or worsen flare UPS through relaxation techniques like yoga, meditation, or deep breathing. Eczema in children and infants. Eczema is especially common in babies and young children. It often appears within the first 6 months of life. Although many children outgrow eczema, some may continue to have symptoms into adulthood. Managing eczema in children requires extra care to ensure proper hydration and prevent scratching, which can lead to infections. Psychological impact. The chronic itch and visible rash can lead to emotional distress, low self-esteem, anxiety, and depression. Children with eczema may have sleep disturbances and difficulty concentrating in school. Psychological support and counseling may be necessary in severe cases. Prognosis. Eczema is a chronic condition that tends to flare periodically. With proper care and treatment, most people can manage their symptoms effectively. Advances in treatment, especially with biologics, are providing new hope for people with moderate to severe eczema. Conclusion. Eczema is a widespread, often frustrating skin condition that significantly affects daily life. Although it cannot be cured, with consistent skin care, avoidance of triggers, and medical treatment, most individuals can lead comfortable, productive lives. Continued research is helping to uncover more targeted therapies that improve long-term outcomes for those living with this condition.
Thank you for watching. Please subscribe our channel.